Hi, everyone. I think we'll go ahead and get started. I know people will probably still be joining a few minutes late, but we're at 2 minutes past, and so I think we'll just go ahead and get going. Um, Welcome to our annual Fall Implementation Science Seminar Series. My name is Dr. Alethea DeRosiers. I'm an assistant professor in the Department of Psychiatry and Human Behavior at Brown University and a faculty member in our Bridge program. I'll be hosting this fall seminar series. Just to note, our implementation science core in the Department of Psychiatry and Human Behavior has recently rebranded as the Brown Research on Implementation and Dissemination to Guide Evidence Use, or Bridge program. This is the 6th year of our implementation science programming, and we are thrilled to bring these seminars to our Providence and Rhode Island community of implementation scientists, as well as those of you who are joining us from other states or perhaps other parts of the world. We are grateful for the partnership of the Advanced Rhode Island Clinical and Translational Research, or Advance-CTR, for supporting the technology, logistics, and marketing of these seminars. And we also recognize our partnership with the Brown Alcohol Research Center on HIV for their support. Today, I am very pleased to welcome Dr. Shoba Ramanadhan, who is an associate professor at the Harvard T.H. Chan School of Public Health. She is a behavioral scientist with expertise in implementation science, cancer inequities, and participatory research. Her research focuses on improving research practice linkages for community-based organizations serving marginalized populations in the US and in India. Using participatory approaches, her goal is to reimagine capacity building for using evidence-based interventions in community-based organizations. This includes expanding the range of intervention targets, leveraging staff social networks to support implementation, and centering practice-based evidence in social change efforts. The title of her presentation today is Pragmatic Qualitative Analysis for Implementation Science. As a reminder, you can put your questions in the chat throughout the seminar. Thank you so much, Dr. Ramanadhan. I will turn it over to you now.
Right, thank you. As I get going, I just wanted to start by acknowledging my colleagues who are part of this work. The folks on the left-hand side co-wrote a paper with me that I've got in the deck for your reference if you're interested. And then I also wanted to acknowledge the team of community and scientific partners that you see on the right. We're part of an outreach core for a U54 partnership between the Dana-Farber Harvard Cancer Center and UMass Boston. And so all of this work exists because we do it all together. So I thought in our time together, we could talk a little bit about this idea of pragmatic approaches to qualitative data analysis, really with the goal of talking about how we adjust our analytic plans to be strategic, to borrow what we need from different kinds of approaches, to bring other folks along with us as we're making those decisions. And for the why, so we can have that transparency and folks can see sort of our decision-making process, the justification for our analytic plan and so forth. Also so that we can increase the fit between our analytic plan and our research goals, our resources, and other factors, all in the service of enhancing and preserving our analytic rigor. And then we'll talk a little bit about the how of that, sort of, how do we integrate these kinds of considerations into the development of our qualitative plans. And I'll give you a worked example throughout just so that you can see how we've been using this in some of our work. So when I'm talking about pragmatic approaches, thinking about strategic combining and borrowing from established qualitative approaches. So by approaches, I mean things like grounded theory or ethnography, so forth, to meet the needs of a given IS study, often using an IS framework. Nobody loves frameworks like implementation scientists, I think, and with clear research and practice change goals. So just to make sure we're all on the same page, I just wanted to start with this idea of common analytic approaches that we see in public health. And I'll go over a few of the ones that I see a lot, but I'd love it if you all would share in the chat some of the approaches that you've been using, or if this is fairly new to you, just let me know with a none as well. That'd be great to just get a sense of who's in the room. So I think we often see thematic analysis. So we're looking for patterns, trying to identify connections in our data to these sort of broad themes or domains of interest for our research question. We might use interpretive phenomenological analysis, or IPA, where we have a smaller number of cases. Say we're going deep into the experience of implementers or those receiving evidence-based services, and we really want to understand their lived experience. So smaller numbers, deeper inquiry. Grounded theory may be familiar to folks. I don't know about you, but for me, I sort of was trained quantitatively and kind of came to qualitative research with this idea that you just have to say, I'm using constant comparison, and then no one will ask you any questions. And luckily I've gotten more training and gone more in depth in this. And I think we're also seeing that folks feel less obligated to say that they're doing grounded theory in their work. And yet we can pull elements from it that are really helpful, especially in a field like implementation science, where we have some ideas of what makes things work, but we really want to allow for that openness. And this is great to see. There's a lot of thematic analysis, IPA, rapid approaches, case studies, ethnography, wonderful. So case studies, again, a deep examination of an event or a process or a small set of them. So often in implementation science, we'll see folks doing these multiple case studies, looking at implementation of a given intervention across a range of types of settings, basically to understand the process and sort of generate some transferable information from that. Ethnography, we've seen a lot. So what, that deep dive into what is the implementation context, right? Who has to be implementing this intervention? I think we've seen a lot of this in clinical settings to understand sort of what the culture is in a given environment as we're thinking about bringing in some sort of new innovation. And then finally, narrative. I think we see this maybe a little bit less in implementation science, but can be really helpful as we think about looking at qualitative data and understanding the stories that are told. So how are people making sense of their implementation experience, or recipients, how are they making sense of receiving services? What are the chronology that they're expressing to us? So we might have an idea for an implementation rollout and it might come out a different way. So we kind of look at these stories to understand meaning making, how folks are thinking about events unfolding over time, all of that good stuff. And I found this little touristy poster of Rhode Island online. And it was just thinking, I was just thinking about, this idea that we, in qualitative work, as many of you know, and clearly from the chat, we don't have like a single right answer that or a right way to do something, right? It depends on where we're going and what we're trying to do. So according to this map in Rhode Island, you can see a lot of chickens and apples and maybe do some golfing and some sailing. So that question of what we're trying to do will drive us to take really different routes and identify success in a really different way. And I think that's the, sort of fundamental theme of this presentation, is really that there are a lot of different ways that we might approach our work. And we really want to be thoughtful about matching what we're trying to do with our work to the route that we take and the kinds of outcomes that we're looking for in a given study. So the why for this, the colleagues I showed you at the beginning of this presentation, we all teach qualitative research. We do a lot of qualitative research. We do a lot of consulting for other academics who are interested in using these approaches. And one thing we kept hearing was, am I doing this right? Am I taking the steps as I'm supposed to in this given approach? And we really kind of wanted to give folks the sense of comfort that there is this opportunity to blend, to borrow from different approaches, as long as we're justifying and it's a really strategic selection. And so, this idea of ensuring that it's transparent, right? Do we show people how we got to where we ended up in terms of building pieces of the analysis together? Are we centering rigor? Right? Is this worth asking? There are so many implementation questions we can ask. Are we doing something that has the opportunity for research and practice change? Are we making those deep investments, and are we showing folks who are reading or reviewing our research what those deep investments of time, resources, the processes, all of that, are we showing that we've done the work? Are we conducting this ethically? And that includes, the dissemination and sharing of data, right? Or have we considered cultural considerations, all of those things. And then finally, is it coherent? And I think this is the trickiest part with this blend, borrow, and justify approach, is that you want to make sure that there is a coherent through line between the goals of the study, how we've executed it, the findings, and then how we're interpreting. And that can be a challenge when you're drawing from multiple approaches. And then finally, fit. Is this reasonable? We're in public health. We're always short of a few dollars, like the resources that we have, the goals that we have, can we actually achieve a rigorous study given our constraints and given our assets? And so I'll talk you through a little bit of what I mean by that. So for fit, some core considerations, and I will say Trish has the deck, and I'm happy for anyone to have it, so you don't have to write anything down. But this idea that we want to think about our products needed to meet our research and practice goals, right? What kind of advances are we looking for in the scientific literature? But also, so many of us work in a way that is so grounded in our practice settings. What are those immediate and long-term goals we're trying to see in terms of practice change? As I mentioned earlier, thinking about the availability of staff, time, and other resources, we have to be pragmatic. And so this is really a question of what can we do in the most aligned and rigorous way, given what we actually have. Thinking about balancing participant and researcher perspectives. What is that balance between sort of that insider-outsider dynamic that we see in qualitative research? And again, sort of going back to those implementation science frameworks, this question of how do we balance inductive and deductive activities? And of course, the idea is that for any given project or even a sub-project, this balance is going to look different. And so we are kind of constantly negotiating, even through an analysis, this idea of fit and making changes along the way. So just to give you a sense of how we have used this in our work, I do a lot of work in community and faith-based organizations, working with marginalized populations here in Massachusetts and also in India. And one of the big challenges, as we all, this is sort of our bread and butter in implementation science, is this challenge of limited use of these interventions. And here, this is a little bit more of evidence-based programs, maybe getting folks screened, helping them manage chronic diseases, things like that. Our goal was to increase the use of evidence-based interventions, or EBIs, in community and faith-based organizations that are addressing health inequities. And we focused on capacity building. So really looking at knowledge, skills, motivation, and resources to use evidence-based interventions. This was part of a participatory implementation science project, and it was co-led with coalition leaders from 3 Massachusetts communities experiencing cancer inequities. And you'll see how that kind of flows into some of our analytic decisions. So in terms of data collection and approach, we conducted focus group discussions with the folks who would be receiving capacity building interventions. So staff and practitioners from CBOs, as well as volunteers and health ministry staff from our FBOs. We also conducted key informant interviews with community leaders. So these are a lot of folks who were leading coalitions or doing other sort of high level work where they'd get that bird's eye view of how evidence is being used in their community, what people need from professional development, all of that. And we used a modified framework analysis approach. And for those who aren't familiar, you can think of it as sort of a more structured version of some of our thematic analysis approaches. And part of that was, in the interest of addressing some of our time-sensitive goals. So we really wanted to have a little bit more structure in this so that we could execute on some of these products that I'll show you in a minute. So when we're thinking about identifying the research and practice products, we often think of like scientific products and then our practice focused findings and products. And I wondered if the group would be willing to share the kinds of things you're attempting to create. So, we have our usual scientific presentations or our journal articles, but what else are folks interested in creating when it comes to either practice pieces or other kinds of scientific products? An implementation blueprint, great. Intervention content and structures, reports for funders, absolutely. Policy briefs, one-pagers and presentations for getting feedback, infographics, implementation again for facilitators. This is great. So I think that range of products that might sit as a complement or even outside of our core research questions, it can be really helpful for us to be thinking about those from the get-go, because again, it's going to maybe determine the kinds of analytic decisions that we make. So in this project, we wanted to link or we wanted to think about analytic goals on the research side, to think about how do we improve the design and delivery of capacity building interventions. So I've been doing this work for 15 years, and we just get so many complaints about what academics are offering in terms of capacity building, right? It's too theoretical, it's not grounded in practice, it doesn't relate to my community, all of these things. And so we wanted to get a sense of how can we do better, and how can we contribute something to the field so that all of us who are producing these kinds of interventions, either in academic silos or in partnership, can do a better job and advance this important work. And so we thought we would share that through manuscripts and presentations. This is a while ago. I think we would think about this a little bit more creatively now. But then on the practice side, we wanted to understand in our 3 partner communities, what are the local training needs, and how can we refine this existing evidence-based intervention capacity building curriculum? Because that was part of our commitment, was that we would deliver these refined trainings to folks and support them in using evidence-based intervention. So the products then are this refined intervention, but also reports to our stakeholders regarding how can they design professional development activities for their constituents more effectively, and also how can they solicit professional development more effectively to make the most out of what their staff need. And that was, I think, the thing that was of equal, I think these were of equal importance to our community partners. And again, these are coalition leaders. They wanted to say, yes, we can now offer this refined intervention, but also we can reshape how we're thinking about professional development in our community, in our coalition. So another piece of the how is how we balance theory and data-driven approaches. So we often talk about these as deductive versus inductive approaches. Just got some definitions on the side for folks who might be newer to this. But again, this question of where are we bringing in our implementation science frameworks, right? Is it more of a light touch this side, where we're just trying to get a sense of what is the scope of inquiry, right? What are the range of domains that may be of interest to us? But we want to, allow for a lot of openness in terms of what, say, our implementers or our policymakers or whoever, our participants of interest are, what they're seeing. We might have that sort of middle ground where we are relying on the frameworks to a certain extent, but also allowing for a lot of this sort of emergent information to come out. And then you might have folks who are almost entirely relying on theory to drive the analysis. And I think we've seen a lot of examples in implementation science where somebody might take something like the CFR and use that to design their interview guide. And then they're doing the analysis really based on the domains as put forth by the theory developers, right? And so that could, that's sort of, in my mind, one of the examples where we see a lot of that very heavy reliance on IS theories, models, and frameworks. So in our project, we use Greg Ahrens and colleagues' exploration, preparation, implementation, and sustainment framework, the EPIS framework, and we relied on it fairly heavily at the outset. So if you looked at our interview guide, you would see, many of these domains around outer context, just trying to get a sense of how does that impact the ability of CBO staff and FBO volunteers and staff to use evidence-based interventions. We talked a lot about the fit between available interventions and the needs of our participants in terms of potential mismatch with the communities they serve, the resources they have, all of those things. We talked a little bit less about bridging factors, but again, more on the inner context, who's supporting the use of evidence-based interventions, what does staffing look like, especially in these kinds of institutions where the staff are, underfunded and there's an over-reliance on these staff to do a lot of different work. And then we understood some of their individual characteristics as well. So we relied on this fairly heavily to get our, project going. But we also found that a lot of these ideas, they just didn't resonate. Like, this was not how practitioners and health ministry folks were thinking about the implementation world. And so we really allowed for that openness as well to say, okay, well, you tell us what is driving it and how else we might be able to think about this. And so by the time we got into, further down the road of data collection and then starting to do the analysis, the framework became a much lighter touch. So it was a much looser set of domains that we were looking at, but we had wanted to rely on it a fair amount at the outset because we wanted to make sure we were asking about all of these established domains, given that this framework does so well, with social service agencies. So when we're thinking about the available resources, I think first of all, it's important for us to be thinking about constraints, but also assets. We think about the staffing that we have for our qualitative projects, the funding, the expertise we have in-house, and of course, time. So I'm curious for the group, what kind of juggling you need to do. And so how you think about how your approach to a given qualitative project might vary based on some of these factors. Because I know we all could use more money, more time, more staff. But how does that show up for you? Time affects how I plan to do reliability. Margaret, if you're able to unmute, would you mind sharing what you mean by that? I'm really curious.
Sure. I'll also just show my video quickly. So thinking about qualitative analyses, right? So I mean, there's many takes on how to do reliability within qualitative analyses of like how many coders to have, if 2 coders code the whole thing together, if one does 20%, if it's 20%, are you trying to get reliable to kappa, or do you just discuss discrepancies? Each of those approaches both require different amounts of time, but then also have kind of different theoretical groundings of how we think about reliability in qualitative analyses.
Yeah, I think that's really important. And again, maybe this is part of the question of who all are your audiences, right? So I don't personally measure kappas. I don't report them. We use just sort of a different sort of frame on this, and the idea that our goal is not actually to get folks who are, say, double coding to tell us the same thing that they're seeing, as much as it is for them both to engage with it deeply. And if we're seeing, if there's discrepancies, that we're allowing that to build the richness of what we're understanding and what we're seeing. I will say not all audiences are receptive to that. But in the spaces I live in, that's been the approach that I've been able to take, and I think is, for me, compatible with the underlying worldviews of qualitative research. Ronnie, I appreciate what you're saying. My partners have no time. They want the answers yesterday. And so that drives a reliance on deductive approaches. And I think that that's really true. And I'll, certainly in this project, I'll just sort of move ahead here. We, did that for time. So we were really urgent when it came to practice products. We needed to get that refined intervention out into the field. And so we took a very deductive approach, right? And so that's why that modified framework analysis, where, we have this list of domains, we're kind of seeing what did we find in the different places. And that was really helpful for us to think about all the ways in which participants were telling us the capacity building interventions were not meeting CBO and FBO needs. So we hustled on that part. We were, I would say, much more deductive in that portion of the project. But then we also developed research products, which were more about the science of capacity building. And those, we did a lot more of a balance, I would say, towards the inductive, in terms of allowing for the data to sort of drive what we were focusing on, and kind of going that way. But it took a really long time for us, right? And that would have been completely inappropriate to attempt to ask our community partners to hold off that long. So in this particular project, it was sort of a magical project. We were really well staffed. We had 3 doctoral level researchers. One was quite new to qualitative research, but was really invested in learning. We had enough funds for data collection and analytic support, because again, this project was really about refining our capacity building intervention that would support, a 5-year R01. The time piece already covered, but then we also had the relevant expertise. So we had expertise in qualitative methods, implementation science, and very importantly, CBO practice. So many of our staff on the team have experience working with community-based organizations. Our community advisory board, many of whom were on that first slide, also gave us really in-depth information about what we were seeing in the context of CBO practice and FBO practice at that particular moment. And that leads into this idea of insider and outsider perspectives, right? So we have this question of, how much are we relying on our, what we as a research team are bringing in terms of ideas about how the world works. Again, this sort of understanding of practice from an outsider perspective versus those who are inside and doing this work with evidence-based interventions or not evidence-based interventions, day in and day out. And for us, the solution to avoid sort of laying that evidence-based intervention kind of framework and the ideas of evidence-based public health too strongly on our work was to ensure that we had representation of a lot of different voices and expertise on the team. Sorry. So this is our dream team. Just in terms of expertise, we've got behavioral science and implementation science. I've been working with these partners since 2009, continuing to work with them today. So deep sense of, an understanding of those communities in terms of public health practice. My colleague Anna is a sociologist and a qualitative researcher. So she was the one who brought that really deep methodological expertise. Our colleague Kayol is a nurse and a researcher and has a lot of experience working with cancer inequities and communities of color. And I'm not presenting the details of it today, but we also asked a lot about HPV and biobanking in this project because those were NCI interests, related to this work. And to have a nurse on the team and able to, inform the entire analytic process, was invaluable. And then finally, our community advisory board and our academic partners who have spent a great deal of time thinking about program planning, interventions, and EBIs in community organizations that are attempting to advance health equity. So I think that idea of being able to bridge some of those gaps through team composition is something that we're really just committed to, and it's improved the quality of the work that we're able to do and the analysis we're able to run. So, at the end of the day, I think that the key thing here is this idea that there are so many different kinds of approaches that we can draw on and draw different pieces on, depending on sort of what we're trying to do in a given study. It sounds like we have a lot of experience on the call in thematic analysis, a good chunk in IPA. We've got some folks saying grounded theory light. I don't know that I saw a narrative, but maybe there are folks doing that. But, these are just some examples of things that we can pull from. So, we can think about doing, say, a thematic analysis, but maybe we want to go really, with a very inductive approach and allowing for that openness and the data-driven pieces so that we can, give ourselves the opportunity to expand, our thinking in terms of not relying too much on the existing frameworks or our assumptions, things like that. The constant comparison, I think we do see that a lot of people pulling that in. So the idea that we are continually immersing ourselves in the data, kind of going back and forth to the data, through the analysis, refining our approach and allowing all the data to kind of continually impact our analysis. And then I will say there was a couple of mentions of policymakers. I've seen folks do a really nice job of using narrative approaches, sort of built in to, say, a thematic analysis, so they can get those stories to feed to, feed may be the wrong word, to offer to policymakers who are in alignment, so that you're really able to give that sort of compelling description of how folks are experiencing things, sort of like the time narrative, the journey that they're on. Often that can be a very helpful thing for policymakers to have in their pocket as they're trying to advance policy change. So for this project, what we finally came up with in terms of our analytic plan was that we familiarized ourselves with the data, we read, we listened, we discussed. This is a heavily team-based project among the three of us as the initial analysts and then our broader team. We created our coding framework. We started with framework-based codes. So again, looking at EPIS and thinking about the different domains, but then really kind of pulling back on the EPIS heaviness after a while, and really thinking about how we use open coding to add our inductive codes. And then we iterated, right? So we coded, we went back to the framework or the coding framework, we did codes more. And so we finally ended up with our nice, sort of solid code book. We coded our data related to our main products. So we did double code our data, but the idea was to use our discussions to address our discrepancies and not resolve them necessarily, but use them to sort of build a richer product. As I said earlier, we used a modified framework analysis plan. So we did have matrices where we've arrayed the data sort of, in tabular forms. just to get that broad holistic sense quickly and easily. And we use narrative summaries. So we do a lot of code summarizing, theme summarizing, things like that, so that we can, again, sort of condense our data and be able to see those patterns. And then we reorganized our data to identify our key themes of interest. And so I mentioned a few of them earlier, but really we came out with this idea that, there was too much of a reliance on theoretical information. The examples and the way the data were presented were not consistent with what folks working in marginalized communities were experiencing in their practice, nor was it demonstrating the way in which the research evidence base would actually meet their needs. And it did not center practice-based expertise sufficiently. So those are some of the things that we came away with. And as we started doing this early interpretation, we would go back to our community advisory board and say, look, this is what we're seeing. This is what we're hearing. How would you interpret this? What else should we be asking of the data? And then we go back. And so that interpretive process was, I would say, the most highly collaborative with our community advisory board, again, with that goal of trying to place everything we were doing in context of CBO and FBO practice. And I would say, especially for the faith-based organizations, because our team does a lot more work with community-based organizations. So we really relied heavily on our partners from health ministries to help us understand how these findings, may reflect community-based organizations more or faith-based organizations more, and how that would be, what the nuances would be. And for products, we had a scientific manuscript. So our community partners and study team were all, co-authors on the paper. We created a web-based portal to support the capacity building intervention. And a lot of the content in this, a lot of the frames that we use were very much driven by this qualitative research. The content is very similar to what the CPCRN puts out for their putting evidence into action, but the frames, the local details, the highlighting of local expertise, all of that, was a result of the information that we gained from this analysis. And then finally, we put out briefings, but more importantly, did presentations at coalition meetings to help folks get a sense of what they should be looking for when they're spending their, hard-earned cash on professional development. What are their staff and volunteers really looking for, and how might they be able to leverage that? So again, things like they were looking for things that were highly customized to local cultures, norms, strengths, and issues. They wanted high touch, so really relationship-based, rather than some outsider swooping in, giving a 2-day workshop, and you never hear from them again. And so they wanted that high tech, but then they also wanted high tech in terms of having a lot of opportunities for getting information, getting support. And again, a lot of that was the interactive proportions. So just to wrap up, I always think of Bob Ross when I think of this, but this idea that we have such an opportunity to blend approaches, to borrow from different approaches, but really also to justify what it is that we're doing, so that we are able to do this, sort of very transparent, very rigorous presentation of our analytic approaches, so that folks can follow along and they can, sort of judge the way that we've conducted our analysis, with all the details in hand to sort of see whether it fits for them, whether it's coherent, and all the rest of it. So I'm going to stop there and then just open up for conversation. I figure it's lunchtime, and so no one, I know you all are probably eating and things, but it's kind of nice to hear what you're thinking about and where you're going with this.
Thanks so much, Dr. Ramanadhan. Yeah, I can start fielding any questions that come up in the chat. And thank you so much for this excellent presentation. There are so many really nice concrete examples. I can start us off with one question. I'm wondering, you talked about in the beginning that you also have some research focused in India, and I was wondering if there are any adaptations that you've made or considered making based on the culture and context and the service delivery settings there, community-based settings, regarding like just using some of the IS frameworks like EPIS, and how that might then also influence or change how you're analyzing the qualitative data and that approach?
Yeah. So we actually are running a trial in India, in Mumbai, looking at evidence-based tobacco cessation. And one of the big challenges we had is we grounded the study in EPIS, but one of our big questions was, is this appropriate? You know, should we, is it going to capture the things that we need to capture? Is it leaving out important pieces? So this is also a participatory project. And so we're working with folks who are service providers as our research partners. And so a lot of the work that we did at the outset was to have those conversations around what is this covering that, you know, relates to the service context as you see it, and also what else are we missing? And so we designed our interview guides and our analytic procedures, I would say, to include elements of the theoretical framework, but to be very open about ways in which we wouldn't want to assume that it's translatable. Yeah, I don't know. Does that answer?
Yeah, I think it'd be really interesting to actually see like the adaptations to the frameworks and, you know, come out to in the products, because I think that it's not something that I do a lot of work in lower middle income countries, and I come across this often that they're some of these constructs and domains, they're just not really applicable. They provide a good starting point, but there's sometimes things that need to be adjusted or new ones added. And I think it's just, it could really help grow the field in those settings.
Yeah, that's actually one of the things that we're trying to do with some of the qualitative work we have done with, you know, we did a series of interviews and focus groups with intended audiences like patients, potential implementers, leaders of implementing organizations, and policymakers, trying to get a handle on this. And I think it was really interesting, the kinds of domains that just didn't resonate, you know, and so there's also, you know, as an example, there's a lot more of a hierarchical decision-making process in a lot of the organizations that would be implementing organizations. And so some of the questions around, you know, where do you push back and do you agree with this? It just didn't land, because people said, well, if they say we have to do it, we have to do it. And that doesn't mean it's actually getting done, but the conversation just sort of got stilted there. So I think there has to be a different entry point to understanding where people might say yes and then not do whatever it is that they've agreed to do.
Yeah, no, that makes a lot of sense. Okay, we have a couple questions coming up in the chat. Ronnie, as Dr. Elwie has said, I love that you include your partners in your research papers. Have you successfully encouraged them to serve in a research role with you? And has quantitative or has qualitative research been a natural research approach for them?
Yeah, you know, it's interesting. I feel like folks are a lot more receptive to being actively engaged in the research activities these days. I think that there's a sense of, you know, if our voice isn't included in this stage, this work is not going to serve us. And so I think that's been a pretty big motivator. I will say with qualitative analysis, I have not been successful in getting engagement in the actual you know, kind of coding or summarizing, just because it's so time consuming, and this is not any of their jobs. And so, you know, we've not been able to do that. But what we've done instead is had, you know, just sort of very regular debrief meetings with our partners to ensure that we're, you know, bringing them along as much as we can without, you know, making requests that are not feasible. That said, I've just launched a new partnership here in Boston with an organization that addresses behavioral health for LGBTQ+ youth of